Okay, so today I'm going to be talking to you guys about multiple sclerosis. Now, everybody always talks about the cure for cancer, but nobody ever talks about the mysterious, elusive, yet to be discovered cure for multiple sclerosis. Although no cure has been found as of now, better evaluation of the diagnosis and research will eventually lead to a better prognosis for patients. My interest in this topic stemmed from some research that I did with patients who had MS a few years ago at the Cleveland Clinic. I'll be talking about this research later on in my speech. The four major points today that I'm going to make are background on the disease, diagnosis of the disease, treatment plans after someone has been diagnosed, and finally some research in the area. To begin, let's go over how the nervous system works. First of all, multiple sclerosis is the disease of the central nervous system, which consists of the brain and the spinal cord. Beginning with the structure of a nerve, the stimulus enters the dendrites, which are arm-like structures on the head of the nerve. Then comes the axon, which is a long central portion of the nerve, and finally the stimulus goes to this terminal. At the terminal, neurotransmitters are released. These neurotransmitters then enter the dendrites of other nerves, and the stimulus keeps going. Now, how does the stimulus actually travel? The mechanism by which a stimulus travels is called an action potential. This action potential is pretty much just a bunch of sodium or salt rapidly entering the axon of the nerve. That allows the action potential to be propagated. Now, the speed of propagation can be controlled by the use of something called a myelin sheath. Myelin is just a fatty substance that acts to insulate the nerve. This insulation does not allow the action potential to travel through it, so instead it must hop over it. This allows the communication between that nerve and the next nerve to be much faster. It can be compared to someone simply walking on the ground compared to someone jumping on a pogo stick. Obviously, the person jumping on the pogo stick will be going faster than the person walking. That's why in the brain, there's a lot of nerves that are covered by myelin sheaths to allow faster communication between the brain and the rest of the body. And that's where MS comes in. Multiple sclerosis is a disease such that the myelin is degraded in the brain. This slows down the propagation of the action potential, and it may even cause loss of connection between the brain and the rest of the body. Although regeneration of myelin sheaths is possible, the degeneration is much faster than the regeneration, so it still is bad. Although onset of the disease can occur at any point in someone's life, early diagnosis is the key to preventing increased progression of the disease. So I'm going to start with side effects, which is the primary way to begin diagnosing MS. The main side effects are muscle spasticity, fatigue, and tremor. Muscle spasticity is when the brain sends a bunch of signals to different muscles in your body. That way, the muscles in your body are constantly constricted. This causes a lot of mobility restrictions for patients. Second is fatigue. Patients with MS are always tired, laying around, and don't want to do anything, which is actually worse for their mobility restrictions. And finally, a tremor. Tremor is most commonly associated with Parkinson's disease, but patients with MS also have the tremor. Another way to get proof that the patient has MS is to take an MRI, which is a magnetic resonance imaging. In this MRI, a patient is injected with a dye, which then enters their brain, and it lights up when you take a picture of it. So I have a few pictures of that. So when the area that lights up is called a lesion, and this is areas where the myelin has been degraded. So as you can see, this is a normal brain, and this is areas where there is lightness near the ventricles, or the central portion of the brain. Those areas are where myelin has been degraded. Here's another cut. You can see this large lesion right here, which is a large area of myelin degradation. Furthermore, there's 4 different types of MS, the most common being relapsing remitting. A relapse is just like a cancer relapse. In cancer, a relapse means that the cancer has come back into the body. This is pretty much the same as MS. In MS, a relapse means there's a higher degradation of myelin. So once a diagnosis has been reached, a doctor may suggest different medications in conjunction with some therapy. Keeping this in mind, I'll start talking about some oral drugs. The 3 main oral drugs are Gilenya, Xanaflax, and Tecfidera. Now, they come in 2 categories. One of them is a muscle relaxant, and the other is a disease-modifying agent. Muscle relaxants help decrease muscle spasticity to increase mobility, whereas disease-modifying drugs actually decrease the rate of myelin degeneration. So Xanaflax is a muscle relaxant, whereas Gilenya and Tecfidera are disease-modifying agents. Likewise, there's also a lot of injectable drugs on the market, which is they're actually more widely used than the oral drugs. The main three injectables are Copaxone, Betaseron, and Lioresal, more commonly known as baclofen. Baclofen is interesting because it's actually a pump that can be surgically inserted into a person's hip. This pump can then be renewed every few months instead of having to take a shot every day. However, drugs alone cannot help treat MS. The patient must have physical and occupational therapy as well. Physical therapy can help increase mobility and strength, while occupational therapy can help patients learn how to do household tasks while dealing with their disease. In the future, technology is the key to better treatment and cure, and maybe even a cure. For example, I did my research on how wireless video games may one day help increase the mobility of patients. In my research, I studied parallel games on the Xbox 360 Connect and the PS3. And a patient would come in and play those parallel games, and at the end we would ask them questions on which one they liked better. Interestingly, we found that patients actually liked the PS3 gaming system better, even though that one had a physical controller. It actually makes sense because patients who had any walking aids, such as a walking stick or a wheelchair, could not properly communicate with the Kinect system because the Kinect was completely wireless and used your body as a controller. So the Kinect would pick up the wheelchair as a part of the person's body, and then it wouldn't work. So that's why patients actually like the PS3 better. Some other big research right now is drug research. One of the big ones that I found was estriol, which is actually a hormone that females have, and it is widely released during pregnancy. And it was found that patients who have MS, who then become pregnant, have lesser degradation of myelin during their pregnancy. And they found that it may be due to estriol. So there's clinical trials on that going on right now. Second is a drug called Lemtrada. This drug was actually denied by the FDA for approval, and it's because a few people died during clinical trials. However, it helped a lot more. So the people who came up with this drug are now coming up with a different mix of chemicals that may actually kill less people in clinical trials. So in conclusion, MS is a highly progressive disease, and a lot of research is being done to find a cure. As you look back on what I've talked to you about today, you should think about three things: the different effects of MS on the central nervous system, the different treatment options available to people, as well as the research that is going on right now to find a cure. Funding and healthy volunteers are always needed for these kind of clinical research trials. Thank you for listening to me today, and I hope you learned a lot about your body and about how something as small as a myelin sheath can end up being involved in such a debilitating disease such as multiple sclerosis.